Hello, my dear doctor. Very welcome to PACES online course, my dear. My dear doctors, listen very carefully. I'm Dr. 𝗙𝗥𝗍𝘀𝗦, working as a chairman, course coordinator and mentor of Mrcp courses and the specialty certificate examination courses in SsAcademy since 2009. You'll be glad to know that it's the longest journey of my career of teaching and mentoring and guiding the lots of candidates, and at least not less than 10,000 candidates in country and outside the country, to train them, to sharpen them, to teach them, to guide them, to monitor them, to mentor them the best possible way. More than 150 countries, doctors already are trained for the Mrcp PACES exams, my dear, including Part 1, Part 2, PACES, and also the specialty certificate examinations. And you'll be glad to know that I have been working as a consultant medicine since 2009. So, consultant medicine as a clinical practitioner, parallelly to teach the Mrcp candidates in country and outside the country, makes me more competent as a doctor, as a clinician, and on the other hand, as a teacher, mentoring the prospective candidates for all over the world. So that's why I can say, all of you guys together, I can teach you the best possible way for the Mrcp clinical parts, means the PACES parts. My dear doctor, listen very carefully. Because of the COVID-19, the pandemic crisis that runs in all over the world, it was earlier decided by the Royal College of Physicians, and also they published in their website in 2020 the new formats is upcoming. But the frustrations because of the COVID-19 pandemic, that was not happened. Now once again, this is 2023. Once again, the Royal College of Physicians has announced the 2023 new formats will be started from 3rd date of this 2023. They have given a name, PACES 2023. Yes, my dear doctor, you'll be glad to know that I have been teaching these Mrcp PACES, the direct face-to-face classes in SsAcademy, and also going through the different specialty hospitals in Bangladesh, and also do conduct as a intensive international courses since 2009, and it's been a long journey to train the huge number of the candidates for passing them, for making them to pass their exams, means the PACES exam in their first attempt. So my dear doctor, listen very carefully. Since 2017, we started the online courses and the PACES courses. The online PACES courses is running very successfully since 2020, COVID-19, and during the COVID era, the course is running very successfully. My dear doctor, listen very carefully. Now the 2023, you'll be glad to know that with the full team members, me as a mentor, I'm training the PACES candidates since 2009. And with these huge experiences, you'll be glad to know that I am always being updated by the updated guidelines and definitely updated formats by the Royal College of Physicians. As a proud member, as a senior member of the Royal College of Physicians, as a fellow member of Royal College of Physicians of United Kingdom, including the 3 Royal Colleges, the London, Edinburgh, and also the Glasgow, the 3 colleges altogether, they are updating and they are providing me the updates of the Royal College of Physicians, different exams, different patterns, different thinking, and they are always invited the different open questions and discussions regarding the updating the Royal College of Physicians examinations based on the clinical best practice to provide the best services to the patients in United Kingdom in NHS. You'll be glad to know that I have an experiences to do work as a consultant in United Kingdom, in St. Peter's Hospitals, in Ashford and St. Peter's NHS Foundation Trust, London, United Kingdom. As because I have huge experiences to do work in medicine department, I have gone through the different specialty of the medicines, including the acute medicine, including the gastroenterology, including the respiratory medicine, including the geriatric medicine, including the different specialties of internal medicine. As I have been experienced a lot of things together working in the United Kingdom in NHS, and also since 2009 till today, I'm still working as a consultant, as a clinician, to provide the best services for the patients and also to teach the MRCP students. So I think that I can give you the best from my side. And definitely you'll be get to know that. You can see and you can watch the websites of the SsMrcp.uk.com and ESSMRCPUK.com. In the YouTube channel, in the Facebook, you'll get lots of feedbacks by the candidates in all over the world. So my dear doctors, I'm telling you, and definitely I will give you the full confidence to all of you guys. If you go through the materials that I provided in the PACES 2023, the new formats, you will do the best. Yes, my dear doctor. So I have come forward today to discuss about the new changes in PACES exams into 2023, my dear. The new changes are always a matter of anxieties, frustrations, and depressions because of the peoples didn't know actually what's going on in the new formats, the upcoming formats in 2023, the new formats in 2023 PACES exam. So that's why I have been working in NHS and I have been working as a mentor and as a clinician, so I can provide you the best informations regarding these PACES 2023 new formats, what's going on with that. I will discuss, my dear, the some benefits and also some pitfalls of these new formats, and definitely overall I'll give you the full confidence the new formats is upcoming with the very candidates friendly, my dear. Candidates friendly means it is more yielding, means the past yielding examinations, my dear, the new formats will provide you. It does essentially mean that I must tell you that the new formats will be more easier, more accurate, and more time consuming and very practicable approach to the patient's dealings, my dear, in United Kingdom. And that's why I will provide you the PACES 2023, the new formats now. Let's talk about it, the PACES 2023, the new changes, my dear. Just follow me onto the board. Yes, my dear, I've given the stations, my dear, in PACES 2023, the new formats. So now, my dear, I'll describe a very brief descriptions of the new changes of the PACES 2023. New formats, my dear. Just follow me onto the board. So yes, my dear doctor, if you see definitely you'll have the 1, 2, 3, 4, 5. So you'll have the station 1, you'll have the station 2, you'll have the station 3, you'll have the station 4, you'll have the station 5. So the new formats are just same as before. The old formats of 5 stations, my dear. Means the station number is as same as before, my dear. So now come back, the station 1, and then station 2, and then station 3, and then station 4, and then station 5, and then station 1, my dear. I would love to describe a very short, concise descriptions, my dear. You love it, my dear. Just follow me. The best things, the changes, I must say, this is more practicable rather than the older formats, my dear. And definitely, as I said, the candidates friendly, my dear. What does this candidates friendly, my dear? I'm telling you the massive changes, I must say, the station 2 and station 5. If I'm putting the station 2 and station 5, these 25, if I'm telling the 25, means I'm telling here the 25, station 2 and 5, means the 25, the station name is the consultation, my dear. The station 5 is the consultation. Means you'll have the 2 consultation, my dear. In all formats, in station 5, it was the 2 cases within 20 minutes, the brief clinical consultation. The word itself says that in station 5, in 20 minutes, you have to do the 2 consultations, and that was the brief clinical consultations. Within 10 minutes, you have to take the history, clinical examinations, sit back, managing the patient concerns, and explaining the full management plan and any questions asked by the patients that you need to address them. So it's very hectic and very impracticable as well for the managing all them together in 10 minutes matter. So that's why Mrcp has decided, and making a board and also some pilot study of these exams, they decided that should be very practicable. So that's why they made it 20 minutes for each consultation, and they cut the word, the brief clinical, the word is cutting out, so they put the name, the consultation. So that's why they made a very practicable station 5, single consultation here, and another consultation station is here, means the 2 and 5 is basically the consultation, means rather than the brief is a longer consultation. That's why I have given a name, rather than a consultation, it's a long case, my dear. I would love to talk a little bit to compare the Mrcp UK PACES exam formats, now becoming very close to the Mrcp Ireland clinical formats matter. In Mrcp Ireland clinical format, there is a 2 long cases you have to face. Similarly here, you see, in Mrcp UK, that you have to face the 2 long cases rather than the short cases, means the brief clinical consultations, my dear. My dear, listen very carefully. I would love to congratulate to all the candidates in advance, because of this is more practicable and more easier for the candidates. As I said, the word, this consultation station 25, 2 and 5 is candidates friendly. What does this candidates friendly? You had to manage it in older formats within 10 minutes. Now you got the 20 minutes. For the same works, you have to take the history, clinical examinations, and sit back and addressing the concerns and explain the patient management planning altogether. Any questions asked by the patients, then you need to address them. So you have to do it within 10 minutes. Now it's 20 minutes. So I must say, this is more candidates friendly, and definitely you all guys are very lucky to get such a format by the Royal College of Physicians. We must, yes, appreciate the Royal College of Physicians. Yes, my dear. So that's why it's a very tremendous changes. And once again, I'm telling you, this is more candidates friendly. Secondly, this is the first talk, as I say, the first candidates friendly. As I said, what I say, given a word, the candidates, yes, friendly. Yes, my dear. Candidates friendly. Second thing, my dear, now rest of the stations are 1, 3, 4. So if I'm giving a triangle like this is 1, 3, 4, a triangle. Yes, 1, 3, and 4. Basically, 1, 3, 4 is a short cases, my dear. I'm telling you. So rather than the long cases, I'm telling you 1, 3, 4, 134. You can remember 134. Yes. So these are short cases. So in a broad headings, my dear, these are short cases. So 25, 2 and 5, the long case, 2 long cases, and 1, 3, 4, you have the short cases. So in each and every stations are 2 short, 2 short, 2 short, means the 3 into 2 equal to 6 short cases, and here is a 2 long cases, means the total 8 encounters, means the 8 patients that you need to deal, my dear. So somebody talked that the short cases, as I said earlier, the Mrcp Clinical Ireland and Mrcp UK PACES are very close to each other, the similar formats. So my dear, I'm congratulating all the candidates who are prospective to think about to appear both the exams. So you prepare the same, give the same exams and get the 2 degrees altogether in your pocket, my dear. So I'm congratulating you, my dear. So once again, lovely discussions that I'm going through here. So you see the 1, 3, 4. Yes, these are the short cases. Now let's talk. 1, 3, 4. Among the 1, 3 and 4, 1 and 4, my dear, I am telling you, one case is the respiratory case and station 4 is an abdomen case, my dear. In older formats, in station 1, having the abdomen and respiratory. Now they split it. They kept the respiratory in station 1. They made the abdomen to be here in station 4. That's it. So the formats are as same as before. Nothing is changed, just the changes of the station number. In station 1, you'll get the respiratory. In station 4, you'll get the abdominal station. That's it. Once again, my dear, listen very carefully. They put the communication skills in a short case, the 10 minutes case in station 1, and also they put another communication skills in station 4. So 2 communication skills is added in station 1 and station 4. Rather than the 1 communication skills was earlier in station 4 in 20 minutes. My dear, as I said, the new format is definitely the candidates friendly, my dear. Why? Because earlier in station 4, you had the 1 communication skills. Only single communication skills, and you have to talk a longer, means the 14 minutes talks to the encounter. And after that, you have to give the viva against the examiners. And examiners will ask you so many questions, difficult, complex questions for the 5 minutes questioning, my dear. So it was the format earlier in station 4. Now the good news is, I'm giving you, my dear, you'll be very happy that the communication skills station only the 10 minutes. So in these 10 minutes, you'll be get to know that the news I'm giving you will be amazed to know. What is that? Yes, my dear. Only you need to talk to your patients, my dear. Just you need to talk to the patients. Examiners will just follow you what you are going to do. They will mark on you and you'll be happy. I think I must tell you, you must be happy that examiners are not asking you any questions. Means there is no chance of crossing against your examiners. So yes, sometimes the viva is really frustrating and sometimes frightening for all the candidates talking to the examiners. So my dear, I'm congratulating you all guys. You just talk to the 10 minutes to the encounter for communication skills 1 and another 1 communication skills here for the 10 minutes just talk to the patients. So my dear, listen very carefully. The Royal College of Physicians made a very structured, systematic, more confident, more practicable, more candidates friendly and definitely less exhausting by the candidates in an examination hall in total 2 hours of examinations altogether. So my dear, you see that you are getting 2 cases for 2 communication skills. So you'll have the same preparation, whatever the preparations you are taking the similar, the older formats, the same preparation you are getting the 2 cases, 2 chances. So you'll get the 2 variety of the cases. You'll have the chances, more chances to show yourself, to show your skills and capability to communicate with the patients, my dear. So I must say, I must appreciate the Mrcp has given the 2 important communication skills. That's only the communication skills, my dear. Rather than the difficult, toughest and sometimes very complicated ethical questions are asked by the examiners, sometimes are frustrating, frightening by the candidates. And it was earlier. So I must tell the new formats is once again the candidates friendly, and the second word I must tell, it is easier. Yes, my dear. Fantastic. So the station 1 and station 4 I discussed. The 2 communication skills are added along with the respiratory and abdomen station, my dear, the examination stations. And last is the station 3, my dear. Station 3 is a very lovely station. It is cardiovascular and neurology. Means the cardiac and neurology 2 cases in station 3 just as same as before. The older formats, the station 3, they have not split it, they have not changed anything else. In station 3, the same formats as before as earlier. So my dear, if I am telling you, this is candidates friendly. The new changes is a candidates friendly. If I am giving a summary talk here, you'll have the 2 long cases, means the 25, 2 long cases, 2 consultations in 20 minutes, my dear. Because the station 2 and station 5, the new formats, the long cases or the consultation cases, you have the extreme impulse of chances and opportunities to show your skills, my dear, to the examiners, so that you can get the full marks in these 2 stations and get the pass in your first attempt, my dear. And definitely, I will train you, all the doctors, the best possible way how to get the full marks in these both station, my dear, long cases. And next to the 134, yes, 134, the 2 cases, so the 6 short cases, 1 and 4, having the 2 communication skills with the respiratory and abdomen, and in between the 3 station cardiology and neurology as same as before. But definitely I must tell once again, this is more easier, less frustrating, less frightening, less cumbersome, and definitely less time consuming as well. Yes, my dear, I must tell the new formats are the candidates friendly, easier, and last, I'm telling you, my dear, you'll have the more chance to pass the exams with the new formats, my dear. I must congratulate all the prospective candidates who are preparing for the PACES 2023, the new formats. You are most welcome to train, to guide, to mentor by me, my dear. Yes, because I have been training since 2009, the PACES candidates in country and outside the country. I have a tremendous experiences, my dear, to deal, to give you the best tips and tricks, my dear. Because the tips and tricks are the most important things to be added in your skills to show the examiners to get the pass in your first attempt. My dear, listen very carefully. A good doctor, a good physician having the skills, my dear. The Royal College of Physicians in the exam formats, they have given the skills assessment. The 7 skills are assessed beforehand to get the full Mrcp in your hands, my dear. The 7 skills are, if you get through A, B, C, D, E, F, G, A for examination skills. Yes, my dear, if you know how to examine the patients correctly, systematically, appropriately, thoroughly, fluently, smartly, and professional way, definitely you'll get the full marks, my dear, in examination skills, my dear. B for BINES, I am telling you, means the science, the clinical science. If you do the things properly, effectively, definitely you will have the important clinical science so that you can put together, make the clinical diagnosis effectively, definitely in your exams, my dear. So the A for examination skills, B for BINES means the science, my dear, means the clinical science. And C for clinical communications or communication skills. The communication skills are not present in every stations. While you are talking to the patients, the C skills will be present, my dear, means the communication skills, my dear. Communications is one of the most important things to practice in United Kingdom and definitely in all over the world. If you have the less communicative power, skills are less, so definitely you will have the less chances to be a good, competent and confident candidate to pass the exam in your first attempt, my dear. And a lot of people having very good sharp clinical eyes or maybe the clinical hands, but they are very poor having good communication skills, my dear. So I will train you the best possible way to communication skills, my dear. So A for examination, B for science, clinical science, C for clinical communication, D for differential diagnosis, my dear. Definitely, if you have the good formats, good approach, my dear, to know and to run through a different stepwise fashion manner, you can cleanse the likely diagnosis, top of the list of your diagnosis. Then you can say to the examiner and present the case to the examiner's, my dear. So you'll get the full marks. D for differential diagnosis, and E for judgment means the judgment, means the clinical judgment, my dear. It includes the investigations, management, planning altogether. So A for examination, B for C for clinical communication, D for diagnosis, E for judgment, F for functions means the concerns, my dear. Whenever you have the chances to talk to the patient like the 1 and 4 communication skills, and also station 2 and 5, the long cases, that you need to communicate with the patients, and definitely you need to ask about the concerns of the patients, my dear. And you need to address the concerns. You need to ask the concerns. You need to query. You need to manage it and address it very proper way, my dear. So I will train you how to manage and how to deal with the concerns and how to do that concerns, my dear, the best possible way. And last but not the least, my dear, the G skills is the welfare. The welfare means the welfare, my dear. Welfare is the most important part. A good candidates know how to provide the best things to the patients, my dear, and that is definitely the welfare. And welfare means a good candidate will need to have empathize, and definitely you should not jeopardize the patient's safety by any means, psychologically or physically, my dear. So a good doctor should know this, how to avoid the physical and psychological emotions, whatever, my dear, that jeopardizes that the patient's emotions and psychological matter, my dear, so that you can get the full marks in welfare and welfare, my dear. So once again, the 7 skills, as I say, my dear, A, B, C, D, E, F, G. A for examination, B for science, C for communication, D for diagnosis, E for judgment, F for functions, and G for welfare, with the welfare, with the patient's welfare, my dear. These skills are assessed, and definitely, my dear, if you do train yourself the best possible with all the skills altogether, definitely you will do the best in your exams. By the 2023, the new formats, definitely, my dear. You'll be glad to know that this is the new formats, the new cases, the online course that we are providing you, definitely the best course, the best rated course, and the best course in terms of including all the possible cases, whenever you're going for an exams, means the exam centers, even in the United Kingdom, even in the different countries, in overseas, in India, in any Malaysia, Saudi Arabia, Egypt, wherever you go, my dear, definitely you will have the chances to get all the possible cases that are included in the PACES 2023, the new online courses that are providing to you the best services to give you the full confidence to get the full marks in your exams, my dear, to get the full pass in your first attempt. I hope that, my dear, within a very short, brief, concise, the description that I have tried myself to give you the best things, my dear, the 2023 new changes, and definitely, as I say, is a candidate friendly, easier, and definitely is a more yielding to pass your exams, my dear. Best of luck, enjoy yourself, enjoy the PACES 2023, the new course, and get the success in your hands in your first attempt, and get the Mrcp UK or Mrcp Ireland in your hands, my dear, in your first attempt, and be the good physicians, be the world-class UK-led consultant or the NHS-trained consultant, and be proud of yourself, be proud of your society, be proud of your country, my dear. Best of luck, enjoy yourself. Thank you very much.